What is an osteochondral transfer? What is that surgery? When is it used? And how does it work? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. I provide education, information, and commentary on all sorts of sports and exercise, injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. I've talked a lot recently about articular cartilage, the cartilage lining on the ends of the bones, and why that can be so tricky when it starts to break down. And in our last video, we talked about full defects in the cartilage where there's exposed bone. And I compared it to a pothole in a road, and basically how, you can go in and smooth out the edges of a pothole, but that's not filling in the defect. And I talked about microfracture surgery and how microfracture tries to fill in that defect by poking holes in the bone, getting it to bleed, and it leads to the formation of fibrocartilage. And that works okay, but it's not great. Another option when the defect is really big, or even if it's not so big, is a procedure called an osteochondral transfer. And that can be a transfer from your knee or from a donor. Basically what that means is you're basically taking cylinders of bone and cartilage, small cylinders of bone and cartilage if it's from your knee, and sometimes multiple cylinders, and moving those to basically to the defect. And then you make you carve out a cylinder of bone and cartilage to take out the damaged cartilage and bone, and you put that healthy cylinder of bone and cartilage in the defect. You're essentially transferring normal cartilage to that area, so you may not have some of the challenges with microfracture. It'll be more durable, hopefully, and last longer. And if you do it right, hopefully it'll be nice and smooth. Now, you do leave a defect, but you're taking it from a non-weight bearing area, so in theory it can be a good option. Now, if it's a large defect, and we're talking here, 20 centimeters in diameter, or I'm sorry, not 20 centimeters, 20 millimeters, that would be really impressive, but 20 millimeters in diameter, so we're talking quarter size or bigger, very often you don't have enough cartilage in your knee in non-weight bearing areas to do that, so we'll do it and take that from a donor or a cadaver. And we have to actually do some tests, a lot of times an MRI or sometimes x-rays, to get the right size, because the knee shape, the knee size, the knee contour has to be the same, so that when we implant that cylinder of bone and cartilage from a donor, that the contour, that it's basically still smooth, so you have to be essentially the same size or have the same size knee as the donor. So those grafts can take a little while to get sometimes, but that surgery can work if you have a large area of exposed bone, or it's not just exposed bone, but actually a bony defect. We see that and use that occasionally in young kids, or sometimes teenagers, or even adults, with what we call osteochondritis dissecans, where an area of bone and cartilage dies and breaks off, and it leaves this big hole, so to speak. And we'll get bone and cartilage, basically get a donor part of the end of a femur, take a big cylinder of bone and cartilage from that donor and put it into your knee to basically fill in that defect. And that can work really well. I've had people get back into the military after that surgery. It's a big operation, but in theory you can do really well. Okay, have you had an osteochondral transfer? It may have been, your surgeon may have called it an Oates procedure, O-A-T-S. It may be a mosaic plasty, an osteochondral allograft. He may have called it, or she may have called it, but I'm curious if you've had that surgery. What was your problem? What kind of symptoms did it give you? And what did the surgery entail? How did you get over it? How long did it take to get back to normal? I know I'd love to hear your experience, but people dealing with this problem from anywhere in the world may appreciate that as well. So below this video, share your experience and help not just me, but everybody watching. If you know somebody dealing with cartilage damage, please share this video with them. I want to help as many people as possible. This isn't specific medical advice, but if it gives you information that helps you make the decision that's best for you to help you get back to a pain-free, healthy, active lifestyle, that would mean a lot to me. If you like videos like this and you want more information on sports and exercise, injuries and surgeries, subscribe to my YouTube channel. I record a couple of these videos every single week and they'll get delivered directly to you. All you have to do is click the button in the upper right corner of the page that says subscribe and they'll get delivered, they'll get sent right to you. Thank you so much for watching. I really hope this was helpful, and I greatly look forward to seeing you right here next time.